Why should you use dental floss? In order to keep our teeth healthy, it is important that you take good care of your teeth. Yes, it all relies on you.
Is toothbrushing good enough? I already brush my teeth twice a day.
Toothbrushing can only clean the outer surfaces, inner surfaces, and chewing surfaces of teeth. It cannot remove the dental plaque accumulated at the adjacent surface of teeth. Dental floss should be used to remove the plaque from the adjacent tooth surfaces so as to prevent gum disease and tooth decay. Flossing technique.
How do I use dental floss?
We have to use dental floss every day. Use a piece of dental floss which is approximately 30 to 45 centimeters long. Wind each end of the floss tight around the middle fingers of both hands. Use the thumbs and the index fingers to control the floss, leaving about 2 centimeters of floss in between for easy control. It is hard to control by the fingers if the floss is too long. It is also possible to tie both ends of floss to make a loop. Using a sawing motion to slide the floss into the interdental space. If the interdental space is too small, you can use waxed floss which is easier to slide into the spaces. Wrap around one tooth, making a C shape, and gently pull down to the deepest part of the gingival sulcus, and then slide it up and down against the tooth. No need to use too much force when flossing. When the floss reaches the deepest part of the gingival sulcus, it should not cause any pain. Sometimes the gums will bleed when in contact with the floss. That is because gums are inflamed but not injured by the dental floss. After finishing one of the adjacent tooth surfaces, wrap the floss around one tooth on the other side, making a C shape. Repeat the up and down motions. Clean all other adjacent tooth surfaces in the same way until all adjacent surfaces are cleaned. Then slowly pull out the floss from the interdental space. Flossing sequence. We have to floss in an orderly manner. Firstly, clean the upper teeth, starting from the last molar on one side of the teeth. Clean the adjacent tooth surfaces of every tooth until we reach the end of the other side. Then clean the lower teeth. This way, the adjacent tooth surfaces of every tooth will be cleaned without missing out on any tooth surface. Develop flossing habit.
I know it is good to use dental floss, however, I find it difficult to use.
You are right. At the beginning, it is difficult for most of the people to use dental floss, but be patient and do not give up easily. At first, use the dental floss to clean the adjacent tooth surfaces of the front teeth, because it's easy to see these teeth clearly. When you slowly grasp the flossing techniques, then you can start cleaning the adjacent tooth surfaces of the molars at the back. Also, you can clean a few more teeth every day. At the end, you will be able to clean all the adjacent tooth surfaces of all the teeth by flossing.
Sometimes I feel exhausted at night and do not have time or even forget to floss my teeth.
You need not to brush and floss your teeth only before bed. You can choose any time during the day to brush and floss your teeth. For instance, after dinner, before taking a shower, or during the late-night news on TV. Try to incorporate brushing and flossing into your daily routine in order to develop such a habit. Also, if you floss before you brush your teeth, you will not forget using dental floss so easily. You need to practice often so that you can use dental floss in a flexible way to achieve good oral hygiene. Dentists are pleased to give you professional instruction on how to improve your oral health care techniques, but it all relies on yourself for daily oral health care.